Hello, everyone. I'm Leslie Cornwell, certified nurse midwife with Midwifery Business Consultation. This is the first of many having to do with our telehealth course, Introduction to Telehealth. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only. Content is not intended to be substituting for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises or guarantees it works for your local unique situation. Course objectives, the students will be able to verbalize what exactly is telehealth. They'll be able to verbalize the scope of practice within the telehealth industry. They'll be able to verbalize the historical evolution of telehealth, and they'll also be able to verbalize the benefits and challenges that come along with running a telehealth practice. This topic is important because it allows healthcare providers to be able to see people in and out of in-person clinic settings, especially with COVID-19 and all the transitions that are happening. Many practitioners want the fluid flexibility of being able to pivot easily, no matter if they can't see the clients, there's a barrier that the clients can be seen, or maybe they want to travel as part of their private practice. And so it gives them the flexibility of being able to see people in more computer live streaming options versus overhead cost of a clinic space. It helps to ensure that clients and patients will receive optimal, timely healthcare services when there's barriers in place, whether it's health conditions, whether it's barriers traveling, maybe the schedule is super busy, and being able to see people on evenings and Saturdays when there's a distance in place is a little bit more accommodating for telehealth services. It promotes access, it improves care for certain situations. We're going to talk later about when it's appropriate health services and conditions for us to do telehealth and when it's better to be in person. Telehealth nursing and practitioners, providers all over the country can really transform how care is being often offered within the different dynamics of this technology age. So let's get to the basics. What exactly is telehealth? Telemedicine is electronic virtual medical care. You provide healthcare within a digital system, communicative technology that's HIPAA compliant. A lot of times it's part of your electronic health records. You're able to assess, diagnose, treat, manage, care for your clients in a virtual setting, and sometimes it's helpful, sometimes it's not. So you have to determine what services you're going to be offering and when is it best for them to continue care or start out initially with an in-person visit, and then the rest of the time could be follow-up in a virtual setting. So this telehealth is very interesting. I hear a lot all over the country of what you can do, what you can't do, what the regs are. And the quality of telehealth, there's still a lot of data coming out of, is it better? Is it a new age? Is there a lot of barriers for somebody being elder, or you can't really assess the full assessment of what's going on if there's a lump or there's a blood pressure needs to be taken? Sometimes physical examination is always the best. And so there's a lot of times where the art of even knowing what can be a virtual visit versus needs to be in site is half the trouble with telemedicine. Using technology appropriately has great leaps and bounds of advancement opportunities, but it can also get abused for convenience by a healthcare system, and then it can decrease the quality of care if that person may be better to be seen in person on site and get that human compassion. And the power of touch, the power of empathy is so different when you're in front of someone. But if you're a very unique, skilled care provider and you want to access more people at a large distance that maybe are 3, 4, 6, 8 hours away from you within your state, it gives you an opportunity to increase your service radius that you normally wouldn't have. So you definitely need to think about who you're serving, how you're going to serve them, and then making sure you're compliant and you're using all the standards, equipment, clinical, and technology that you need to for telehealth service. So a person has to look at their state local regs. I know there's a lot of discussion of like how many licenses you have to have, and you need to know every single state and the laws. Even if it's a virtual visit, does it make a difference where you're at, where the client's at? Every state has different guidelines on that. Insurance reimbursement has their own policies, protocols around telehealth visits. It's the same codes whether you're in office or virtual, and sometimes it's not. So you need to make sure your documentation is up to standards. Your assessments that you can do with asking a lot of subjective questions are very thorough, and if you need to have them follow up for more objective assessment and management, that you're doing the appropriate steps for that. At a minimum, a person can provide telehealth services with a notice, HIPAA compliance, care standards, have them pay online. You have a HIPAA compliant telehealth system, an EHR, paper charting, and you can choose to do cash, you can choose to do insurance, but you have clear instructions of how to come onto the visit with you, how to pay, how to get all the health questions answered before or during the visit so that you can do the best. I've seen leaps and bounds of amazing resources, especially in like pediatric urgent care when you've got a mom at home and she's got a lot of kids and one of the kids is sick. You don't want to go to the urgent care. You don't want to go to the ER. There's very cost-effective, quick turnaround resources available on the telehealth service side. So I want you guys to think outside the box of how can you serve in the telehealth world with your unique skills, with your unique passions, and fill a need that's desperately not being met at the historical evolution of telehealth has been very fascinating. It emerged way before COVID-19, but it has made a huge presence on a large scale since then because we were all locked down and the only way we could see people was with telehealth unless it was the emergency services. So we definitely need to look at the history to really understand where we're at and where we're going. Civil War and telegraph transmission communication along long physical distance revolutionized just being able to talk through radios through telephones, getting technology to broaden our communication standards. We don't even realize like how long the last 150 years it was prepping our system for more of a technology age and a telehealth type practice style when appropriate. Telephones in the late 1800s had helped drastically with getting that communication style from a distance. And then we started getting the internet in the 1990s, and it has just been exploding from the old school doctor practices of face-to-face calling to make an appointment to now where you can see anyone in the country or world with a click of the button on your computer. So the radio had drastically helped with that, especially in the early 1900s with communication improvements and the aerial space industry. And now we have satellites. There's a lot of potential with the internet and with telehealth systems. Doctors could consult and diagnose from a long distance if they were the house doctor local and they could call and ask for advice and questions. That was the next step for that telehealth, was being able to get some virtual consulting support based on what they were telling them. So there's definitely a lot of telemedicine via radio, via dispatch, via virtual communication when other people weren't on site. We use it all the time for EMS services, standing orders, ER doctors, communicating on a radio to let them know what's coming in and how it's coming in. Television added to the visual component to telehealth. It wasn't just talking and listening, but it was also seeing and really being able to understand the environment, the situation, the level of empathy got to a different mark once you were able to start seeing people when you were communicating. In the 1960s, there was the first ever video links that had people all over the United States being able to expand their resources of communication. And then as it started getting implemented more into the remote medical treatment facilities, when there were specialists that couldn't go out to those areas because of barriers of distance, they could read lab results, testing, being able to help interpret. Maybe there was a physician assistant, nurse practitioner, nurses local that could communicate with the provider that was managing care, and it's just been extended with time. Space travel has really pushed the telehealth services forward. Telehealth got its first modern upgrade in the 1960s. What could a human being function as in the outer space? And they would need medical support just as much as anyone else did. The human astronauts would need to get taken care of all the way in the outer space. This is like as someone else down the street. And so there was a lot of animal studies and medical monitoring systems and biometrics. They used so much before they put humans on the moon, and even just in outer space travel, they had used medical measurements and telehealth reports to be able to say it was safe going from the animals to the humans. And so there was a little bit in the 1960s and 70s where telehealth started getting some federal funding and started getting some expansion research if it was a good idea and a good direction to start going into to help to bridge those rural areas and the disparities that are occurring where it was getting difficult to find healthcare providers that were able to serve every community. One of the programs was called an extension of the NASA's IMBLMS program called Space Technology Applied to Rural Papago Advanced Healthcare. It's quite a mouthful, but it really helped to leverage the remote monitoring technology systems to serve these really rural, underserved communities. The Papago Reservation in Arizona was their pilot study, and they evaluated the practicality on a large scale of implementing telehealth medicine. And so it was really a sound foundation to showing what remote treatment and distance care can really look like to help fill the gap of what we have. And it's only gotten worse as time has went on. The internet's transformed telehealth. Now we can do electronic charting, we can do telehealth visits, e-subscribing, notes, billing, everything is on the internet and virtually at this point. There's very few practices doing it old school, paper, and you can ebb and flow. You can choose to have telemedicine. You can do 100%, you can do none of it, you can add as your families you're serving need it. So scientists and modern medicine experts have really expanded on the dynamic tools that can be used to do remote treatment. You just have to be very careful as health practitioners. When is it appropriate to be able to use those digital technologies? It's always a risk benefits. How far away are they? Can we see them? I'd prefer to see you in person, but maybe I'll do every other visit, and then the local practitioner, the specialty care, the unique resources, how much can be done virtual and how much has to be done in person really dictates who you're serving, how you're serving them, and what you're going to provide. There's so many benefits of telehealth for the providers, the community. We have massive community healthcare provider crises, and being able to do telehealth, being able to bridge your specialty and skills to a large scale population. You can do virtual support groups, you can do meetings together, you can get communities to take care of each other and be that advocate in that local space. You can improve it if you utilize them correctly. You can get call centers, you can get nurse advice lines, you can coordinate telehealth visits on the spot with a practitioner all over the world. There's so many businesses coming up strictly that are around telehealth support. Being able to treat minor COVID symptoms, people that are sick with infections so that other people don't get sick, are vulnerable populations. It really can help avoid a lot of waiting room, a little bit of distance diagnosis, delayed care, being able to order prescriptions with just a couple clicks of a mouse to see what telehealth urgent services are available to help take care of you and the symptoms you're having. For years before the pandemic, we had always struggled with providing adequate healthcare, who needs to be triaged, how they need to be accessed by specialists in a distance, living in rural communities and not being able to travel. Those were huge barriers forever and ever. And the pandemic has really put it to a higher scale of this can be done. We can give safe care. We can pivot to a different way of giving virtual support when we need to or when it's appropriate. Higher patient engagement rates. It's actually shocking when someone can just get on their computer. They've just binge watched Netflix and now they've got an appointment versus they got to get in a car, the car's not working, there's traffic, there's stress, they forgot, they have a lot of kids, they get distracted. Like there's so many benefits to certain populations to be able to do virtual visits to help with engagement, accountability, reduced exposure, anxiety of a doctor's office. The waiting time is not sitting in a doctor's office or their car. They can just be on hold with their phone while they're doing something else. There is a lot of data showing the better patient outcomes. You need to definitely stress which conditions, and the data is showing with certain monitoring things, blood pressure, diabetes, heart conditions, lab testing, patient monitoring testing has really improved those outcomes to catch things earlier. Virtual visits gives you an opportunity to prevent COVID complications where people really are like pushing off coming in because of money or because of worries of getting someone else sick. There are some logistical challenges that we're going to talk about as we get going, that you can't assess everything. You are going to miss some things. There are certain health conditions that it's not appropriate to do virtual visits. And so we'll go into that later. There's so much data showing that lower hospital readmissions, no nosocomial infections, no-show rates because they just have to hop on their phone or their pad wherever they're at versus they have to drive. There's a lot of steps, parking, waiting, just the stress and anxiety of actually getting there, and how many people have missed appointments and just don't come back because of the cost of the no-show. So there's definitely ways to access more people. Post-discharge follow-up, nursing visits. A nurse can do a lot more visits in a day than if they're doing home visits on a virtual level. They can give instructions, they can be available for questions, they can see if that looks like a minor infection. A lot of patients will say, oh, that wasn't a big deal, but these routine, simple virtual visits, the nurses can catch a lot of things or give some simple advice before something gets really serious. They can bring up questions about simple post-operative devices or postpartum recovery concerns or things in the baby that are normal or not normal. It gives you a lot of educational opportunity and follow-up questions with people's prescriptions now that they're taking them. The level of engagement helps make people healthier, and it makes them more accountable and interested in seeking minor things being taken care of versus reaching they're really, really bad and now they're seeking healthcare services. Cost cutting, there is a lot of data about the value of telehealth and adopting it in the clinic, the hospital space to help distribute some of the resources more efficiently. The service hours can be a little more flexible. It increases motivation, productivity with the clinicians while reducing the stress for the patients and the clinic as a whole. So a lot of times just being able to have a flow where they can hop on the computer and move to the next person versus they go on to room after room and then washing their hands and setting up supplies, turning over a room, it has a big difference. Research has confirmed that high-tech platforms enable quicker and more efficient care in lower cost settings. It helps provider cut costs by the time and distance required for the treatment. They're less likely to have patients skip their visits and easier to catch those minor things before they become serious. They can do a lot of simpler procedures, monitoring, test work versus avoiding unnecessary examinations. There's a lot of HIPAA compliant platforms out there. I just always caution people knowing when it's appropriate to do a telehealth visit versus they should be seen. So these are some of the things we're going to talk about, the challenges with telehealth, the reimbursement. Some of the biggest challenges with Medicaid, Medicare, it doesn't fully pay for at the same level as if they came on site. But the nice thing is since pandemic, if we can say one good thing since COVID, a lot of the reimbursement for home visits, outpatient setting, virtual visits have really been expanded. We don't know how long that will continue, if it's indefinitely or just a temporary thing. The regulations, you have to know every state you're going to practice in and every state that the patients you're going to see are at. And even if they're on vacation, that's totally different when your clients are all in Michigan and then they're on vacation in Florida. You have different rules and regulations of how you can serve them and if you can serve them. So you have to know really, really well, not just where your client lives as a primary residence, but where are they virtually when you talk to them makes just as much difference. So you really need to understand your regs, and your clients also understand that if they're on vacation, a telehealth visit with you may or may not be a reasonable option. Scalability, it's much easier to go on a large scale. Typically, a private practice clinic will be able to serve 20, 30, 45-minute radius versus if you are telehealth, you can serve the entire state or entire region depending on how many licensures you get. And so there's really a lot of implementation, scaling up, and we have to be careful of that quantity versus quality and making sure we're keeping up with that personalized care and not catching and missing things because we're not in front of them. So as an overall conclusion, telehealth has been really redefined the last few years since COVID and the pandemic, and providers are really starting to expand creatively. How can they use telehealth? What can they do for a business, for working? I have nurse midwives in Mexico that do telehealth. I have midwives, nurse practitioners all over the globe that do telehealth. You can serve people on such a large, amazing scale that fits your own lifestyle. Really, it's just the sky's the limits of how you want to set up your practice. There's definitely a lot of cost-benefit analysis. What do you want to serve? How do you want to serve them? How often do you want to be seen? How are they going to funnel into your practice? When should they be seen on site? When do they need to be virtual? How often to see them? How long? These are a lot of things to think about when you're determining your telehealth practice or if you're considering getting employed at a telehealth practice. Lots of great things. Overall, I think telehealth is going to be an amazing incorporated technology to use with modern medicine, but we have to be careful of that high tech, low touch, how we lose so many things that are a part of modern medicine. So my challenge to each of you is how do you make that art of personalizing things, giving back that old school medicine, but also creatively implementing these health resources into your practice?